everyone, and welcome to today's Healthcare Unlock episode. Today's episode is our sixth episode, and we have with us Dr. Adaku Nwachuku, who is a specialist in pain management and physical rehabilitation. Welcome.
Thank you for having me, Shondell.
Dr. A, would you like to give us a little bit of information on your background and your specialty?
Sure. I am board certified in physical medicine and rehabilitation, as well as pain management. With regard to my schooling, I went to New York College of Osteopathic Medicine, and I believe it ties in well with what we are going to talk about today because our philosophy is on treating the whole person, mind, body, and spirit. I am excited to be here today.
Awesome. Welcome, and thank you for that information. So today we're diving into the topic of pain management beyond the pill. So many people assume that pain management is just about like getting a prescription. Does it actually involve, Dr. A?
Well, that is a very good question. I would like to let you know that pain does affect many people, but pills alone are not the only answer. As I stated before with my background, I tend to treat the whole person, mind, body, and spirit, so a holistic approach.
Excellent. Why is it important to move beyond medication?
Awesome. All right. So that is a great question, Shondell. So when we say pills, most of the time we are thinking about opioid therapy, and we know all the different issues that are caused by opioids. Obviously, it's appropriate for some individuals, and we do have to make sure with asking questions that it's appropriate for others. So the thing, like I was saying before, I see a lot of patients who have lower back pain. And one of the things that always comes up when someone comes in to see me is, oh, I've been taking this medication and it's not working. I would like stronger medication to help me stop the pain. And what I often have to explain to people is that all medications have a period of time that they last. So what if a medication lasts for 12 hours? What's going to happen for the other 12 hours? So you have to keep taking medication over and over again. It's a cycle. So why not get to the root cause of the issue, which is most of the time inflammation. So inflammation will cause pain, but then the question is, what is causing the inflammation? So that's when we do more diagnostics. If you're thinking about, say, an infection, you'd order blood work. Obviously, when you're seeing the patient, you can do an examination by touching. You can feel warmth, you can feel like the swelling, and then imaging to target that area that has the inflammation to see what's going on. So getting to the root cause of the issue is better than just covering it up with medication. Usually, I do tell people if something has happened today and we need to, give you some relief, yes, I'll prescribe medication. It could be an anti-inflammatory, something you can pick up from any pharmacy, like ibuprofen or a
Right.
Tylenol, something like that, that can help. But obviously, with prescription, can get stronger medications. After we do figure out the root cause, I do have an algorithm that I provide to patients. It's usually do nothing, which is we're not changing any management if you don't want to listen to the things that I have to say. Some sort of physical therapy if you are able to do the therapy. Medication, like we discussed, is needed. Some sort of intervention. I do procedures in the spine and also a lot of different injections from head to toe, which can help. And then if that doesn't improve the symptoms, I may refer you out to surgery if it's something structural that can be fixed. If I do feel that it's more of something that is disturbing your spirit, something more mentally health related, then I will refer the patient out.
Thank you. Thank you so much. So,
Mhm.
based on what you just said, that was a lot of information, but thank you. It actually shed
You're
some
welcome.
light on some additional questions that I have for you. So, for example, I know you said like
Mhm.
injections, steroid
Mhm.
injections, or other surgical procedures that you do. Can you give us a little bit more information about that so that way if we have patients that would benefit from that, or just to know what options are out there?
I was trained in interventional pain management. So that is literally the step before surgical management, if one can wait that long. So basically, I utilized X-ray guidance to look at the area where the pain is stemming from. And I can place, depending on what the issue is, I can place steroid, which is a strong anti-inflammatory, into that space. For example, again, lower back pain, which a lot of people are familiar with. I would place the medication into the lower back area under X-ray guidance and pinpoint the actual area or the nerve or the joints, whatever structure that is causing the issue. After obviously interviewing the patient in the office. And then hopefully that steroid will kick in within 24 to 48 hours and help to relieve those particular symptoms. Others are, obviously familiar with things like knee joint injections because of
Mm-hmm.
arthritis.
Right.
Yeah, arthritis is obviously, well, not necessarily, obviously, a lot of people understand it, but some don't. But arthritis comes with aging. But if there is no inflammation, as we mentioned before, which is what triggers us to feel the pain, then one doesn't have to do anything. But if there is, then a steroid injection is something that one can do. There is also an injection called a block. So a block is a test to see if where we're thinking that pain is the actual source of the pain. So instead of me going in there and putting steroid, which is a treatment, I put in some numbing medication to see, just like if you go to the dentist and they're trying to say pull a tooth. So I
Right.
put in a block to see if that is the root source of your discomfort. But
Okay, so
everything
what
is, yeah.
regarding the
Mhm.
block, so when you do the block, is it like effective immediately in real time, or is it something that you have to have the patient come back and evaluate, the success of the procedure?
Oh, yes. The blocks are supposed to be real time. That's why it's a block, because it's supposed to block those symptoms. Usually, the medications that we use kick in right away. Again, I'll use the example as if you go to the dentist. Hopefully, it's numb before they start drilling into your teeth. But yes, it's supposed to be effective right away.
Thank you. And you also mentioned opioids. So can you
Mhm.
give some examples when opioids are important and what safety measures or mechanisms that you have to employ before you prescribe them? Or what is
Um,
an opioid? I'm sorry to go back. Exactly what is an opioid? Let's start there.
Sure, no problem. An opioid is a controlled substance. It is a strong medication that works in the brain to block pain. Depending on the particular type of information of medication, there are different formulations. Some are short acting and some are long acting, but they are effective in blocking pain.
Yeah, like I was saying, the second part of the question, when
Mhm.
examples of when it's appropriate to, or a patient where you would prescribe a patient an opioid.
Sure. Opioids are effective in acute and chronic pain. Acute pain meaning, say, if you have a sudden injury and you go to the emergency room and they are trying to figure out what's going on, giving an opioid medication might be beneficial in calming those symptoms down in order to provide effective treatment, maybe do diagnostic studies. It's also appropriate after surgery, after one has gone through vigorous surgery, it can be quite painful afterwards. So it's used post-operatively to help diminish the symptoms so that someone can be up and moving, in a short period of time.
Mhm.
It's also effective in chronic management of pain. And obviously, this is where I sometimes come in because I'm in an office setting. Basically, there are things that are employed before I prescribe the medication. I do have to see the patient, do an interview, just like everyone else. Um, there is a risk tool that I provide to patients. There are quite a few questions, and it determines if the pain can stem from mental health or some trauma that occurred in the past versus physical. Again, it's not 100% proof, but it can serve as a guide. I also do urine toxicology, just to make sure that there's nothing else in the system that can counteract with the opioid therapy, if that's something that we wish to prescribe. I do monthly follow-ups for patients. If I feel that I need to see them sooner, I bring them back, obviously in a week or 2 weeks, just to make sure that they are doing well with the therapy. We now, because of the opioid crisis, have to prescribe a medication or rescue medication called Narcan, and that reverses opioid overdose. So we have to give that to, or I give that to every single patient that I prescribe an opioid to. Again, we have fire extinguishers in our home. We don't necessarily, have
Mhm.
fires, but we have it. So it's just something of safety that we provide to patients.
Right. Thank you for that analogy. Fire extinguishers at home, but then what
Mhm,
about if you run into trouble with this
mhm,
opioid? Then what? So thank you for that analogy. You mentioned opioid crisis. What
mhm.
can you define that a little bit more? Like, what does that mean?
Sure. Some time ago, and I don't remember the actual year, but
Okay.
some years ago, the CDC did declare, and the White House declared an opioid crisis, meaning that there were a lot of quite a significant amount of opioid deaths.
Okay.
I think that it was prescribed and non-prescribed. I can't say if it's one or the other, but opioids were
Hmm.
all lumped
The cause
together.
of death.
And
Okay.
yeah. So
Wow.
there were quite a significant amount of opioid deaths. And then the CDC did declare that and then provided more safety guidelines
Right.
for physicians to utilize. And that has kind of pushed more primary care doctors and other docs to send patients to pain management physicians because we do a lot of monitoring for the patients who we prescribe medications to.
Okay. Thank you. So besides
Mhm,
like the opioids and the injections that you mentioned, are there
mhm.
any other options or treatment relief for someone suffering from chronic pain?
Yes, depending on the type of pain and the patient's outlook, I do again look at everything. Their medical issues. Do they have high blood pressure? Do they have diabetes? Are they overweight? So I pretty much again recommend some sort of movement. So like walking. A physician directed physical therapy program. I do look at nutrition. What are you eating? Are you drinking soda every day versus water? That's going to cause increased weight gain. That's going to cause inflammatory factors to swirl around in your blood and increase whatever discomfort you have. Again, as I mentioned, seeing how their home life is, seeing what trauma they had. Do you need to go see a mental health specialist? Do you need to speak to your clergy if that's who you talk to? Um, Other things like just making sure that you're playing with your grandchildren or your children, things that can make wonderful things swirl around in your brain. Those chemicals
Mhm.
come out in your brain. So looking at someone as a whole, and I do have a wellness program that I am starting, and it is called Dr. Ada's Lane, and Lane stands for lifestyle, how we live. A is for attitude, how we think. N is for nutrition, how we eat. And E is for exercise, how we move. So, in that, someone can find their lane and thrive in their lane.
I like that. Lane, lane.
Yes.
Alrighty. Can you share some success stories, either through your wellness program or at your pain management clinic?
I do have one actually, and I wouldn't even say it's my success. I would say that it's the patient's success,
Okay.
or a team success, right?
Yes.
But the thing is that she actually came to me as a new patient, probably a 70-something-year-old. So she said that she just wanted to come because her doctor told her to come to see me. Because she kept on complaining about lower back pain
Mhm.
when she saw her like every 3 months. So this patient, I interviewed her and everything, and she actually told me, yeah, I decreased, the junk food that I was eating, whatever we think of as junk food.
Yeah.
She decreased the junk food she was eating. She started drinking a lot more water. She started doing exercises. And can you believe this 70-something-year-old was doing squats? And I said,
Wow.
wait, can you show me how you do the
Yeah.
squats? Because I was
Uh-huh.
afraid that maybe, I don't know. And I didn't have anyone like come to kind
Right.
of
To
assist her just in
support.
case she
Uh-huh.
fell, right?
Uh-huh.
But yeah, but she did the
She
squats.
got
I
up.
mean, she
Nice.
was by the wall and
Uh-huh.
everything. So she said, I've been doing this. It strengthened my legs. It has, this has changed my whole outlook. And so I asked her, why did you come to see me? You're actually going to pay me for a visit. And I didn't even do anything. You
Right.
had all the tools. And I kind of feel bad taking your money. I'll take it, but you you had all the tools to begin with.
Nice.
So I asked her if she wanted to come on the road with me, and she declined. But we,
Maybe you
but
actually
she
should
is,
record her
I
and
should
have you did?
probably.
You did already? Or you will?
I did not record her.
Yeah,
No, I
record.
did.
I mean, not her doing the squat, but just her
Oh, yeah,
telling
yeah,
her
yeah.
story. And,
Yes, yes,
so I
yes.
noticed that as well, like patients, when they start to feel empowered, like that's a big thing, empowering patients,
Hmm.
about what it is that they're going through, teaching them how their body works and what they can heal on their own. And once they accept that and take ownership of it, that's a wonderful success story.
I
So just
agree.
quickly,
I
I would like
agree.
to ask, can someone see you without a referral?
Yes. Obviously some of the things depend on which insurance one has, but yes,
Okay.
I am open to people seeing me.
Okay. And how about, let's say,
Hmm.
if someone is seeing their primary care provider and they have this
Hmm.
pain, when is it appropriate, would you say, that, okay, now this patient needs to be referred for pain management versus just being managed by their primary care provider?
Sure. Again, most pain comes from inflammation. So when you determine the source of the pain, and most people send their patients to a physical therapy program, if they don't improve within, say, like the 6 to 8 week initial time period, I would say that that is the time to send them.
Okay.
Also, if imaging has been obtained and it shows some sort of structural abnormality, that say the physical therapy is not going to help, right? So if there's like a big structure like a disc herniation pressing on a nerve causing a lot of weakness in the
Hmm.
leg, people are tripping and falling, all those different things, then I would say yes, send them to a specialist like a pain management
Okay.
provider. If they are having problems with their bowel or bladder, that's not good, send them
Hmm.
straight to a surgeon.
Yes.
But any of those cases, yeah.
Okay. And I just want to kind of circle back to something that you mentioned, which tied in last week's episode, Healthcare Unlocked. We had a GI provider, and he
Mhm.
mentioned processed foods, like eliminating processed foods. So now we see today that it has many benefits, right? Not just like GI, not just for like weight management, but also for health management. So that's amazing. Thank you for sharing that. So
Yes, yes.
what is the one takeaway, or maybe two, right, that you would like
Mhm.
for people to take away after viewing this episode?
I would like to let people know that pain is a sign that we're alive. Most of the time, patients come in, they're like, I want to be out of this pain. I'm up to, I'm taking this medication, that medication, and it's not helping. Give me more, give me an increased dose.
Right.
So I always tell people, I'm happy that you're here. If I were to remove all of your pain, you may not be here. So pain is a sign of life. Embrace it. And then, another one, like you mentioned
Mm-hmm.
about cutting out processed foods. Like
Mm-hmm.
a lot of us, we hold our increased weight, me
Yes.
included, in
Mm-hmm.
our abdomen.
Correct.
If you work on your core and decrease the weight in your core, and
Mm-hmm.
that comes with the lane, your lifestyle, attitude, nutrition, exercise.
Yes.
If you decrease that weight in your core, you will see that a lot of your inflammation
Mm-hmm.
will diminish, and
Yes.
then your pain will also diminish as well.
Okay. Excellent. Thank you. Thank you. Thank you. So before we wrap up, I would like to take a few questions from our audience. Okay. So Dr. A, here's what people are asking. Is it safe to stop taking pain meds if I start eating healthier and exercising more? That's one
It's
of
a
the
great
questions from our
question.
viewer. Yes.
Awesome.
Is it
Wonderful
safe to
question.
just stop taking the pain meds? Just I guess maybe just cold turkey. They're asking.
Oh, okay. It depends on the dosage and how many times a day. Say if you're taking something every 4 hours, I would not say stop cold turkey. I would say work with your physician to wean down so you do not have the symptoms of withdrawal.
Hmm.
And that could, include anything, right? From flu-like symptoms to feeling jittery, like any of those things. So if it's one time a day something, yes, you can stop because your body is not used to the many times. But if
Right.
it is many times a day, then yes, wean down. But again, you will see that if you start implementing those lifestyle changes, your pain will be less and you will decrease on your own with
Right.
taking the medication.
Hmm. So let's say, thank you for bringing up that point, right? Let's say if a patient were to start experiencing withdrawal symptoms, right?
Mm-hmm.
What do they do at that point? Are they to use the Narcan then? Then never, I think we never even talked about like, okay, so when did they use the Narcan now that they have it? What do
Oh.
you tell your
Mhm.
patients?
Oh yes, so Narcan it is for an opioid emergency. That's if
Hmm.
you've taken too much, or
Oh, too
if
much. Okay.
And
Hmm.
again, I say why do we prescribe it to the patient and not have like their loved one in the room to explain what's happening,
Hmm.
right? Because say if someone lives alone and they have the Narcan, are they really, if they're not awake, are they going to give themselves the Narcan?
Right.
No.
That's
So
true.
it's for you to teach your family, say, hey, it's in this closet. If
Hmm.
anything
Hmm.
happens, and hopefully, right, we're not prescribing to someone
Right.
who may have that type of issue.
Yes.
But yeah, but the Narcan is for an opioid emergency.
Okay.
If someone is having withdrawals, and I
Hmm.
always say this, the opioid overdose, yes, can be catastrophic. But if you're having withdrawals, it's not. You'll feel bad, but it's
Hmm.
not an emergency. But simply, call the provider or your primary care.
Hmm.
If you're feeling like it's an emergency,
Hmm.
definitely go to the emergency room
Emergency
so
room.
that they
Okay.
can treat you. Hmm.
Perfect. Okay. Here's another question for one of our viewers. Can stress alone cause physical pain? Like just being stressed out, can
Hmm.
that just lead to pain? I want to say yes, but correct me if I'm
Hmm.
wrong. I would just say even a headache sometimes, right? Even just having a
Yes.
headache could be a source. The source of that headache could be pain, but
Hmm.
I'll let you take it
Yes.
away.
Oh, no problem. Yes, definitely. Stress can cause pain. As we mentioned before, anything out of balance in the body can create inflammatory type factors. And once there's inflammation swirling all over the place, you have
Hmm.
physical issues,
Right.
problems with sleep, a manifestation of, headache or back pain, chest pain, right? If you're having anxiety, things of that nature. So yes, relieving stress is good overall for everything, right? For
Hmm.
our pain, for our heart, uh, for our community.
Yes.
So I agree.
So as you know, I'm on my little like health and wellness journey. So I
Yes.
have a question. No, I don't have a
Mhm,
question, but one of the viewers' question, and it's something
mhm.
that is personal to me as well. So it says, what anti-inflammatory foods should people focus on? Like, what would you recommend?
So I'm going to say all junk foods are inflammatory.
Yes.
So, or
Okay.
most, right? Except for those that
French
are in
fries.
the like
Okay.
organic.
Hmm.
I know
Okay.
the organic.
Hmm.
You're too much realm. So most snacks, right? Yeah,
Okay.
snacks. Yeah, or
Yeah, processed food snacks.
inflammatory, yeah,
Okay.
processed foods and things of
Hmm.
that nature, right? So stay
Okay.
away from them. And then, as far as foods that are good, vegetables. I'm going to say lean meats. A lot of people say cut out meat and things of
Hmm.
that nature.
Hmm.
The issue with some of that stuff is that people eating the fatty portion of the meat. So if you
Hmm.
have the lean portion of the meat, if you kind of shop or in an organic place, like those
Hmm.
are probably a better fit. Obviously, incorporating water, a lot of fluids. I know people say, "Oh, I'm drinking soda," but water is the
Hmm.
better one to do. A lot of say things like ginger, like I
Yes.
mentioned, turmeric, curry,
Hmm.
cinnamon, things of pepper, cayenne pepper. All those different things are beneficial. Hmm.
Okay, awesome. So let's say if I have this. pain, one of the questions are, how can I manage if I can't exercise due to mobility? So, what other alternatives do they have? I'm guessing to manage their pain if they're not able to exercise due to their mobility status.
Hmm. So that's a good question.
Mm-hmm.
So I would say with that, one can, if able, like have a caregiver, a family member, sort of do the exercises with them, whether it's
Mm-hmm.
like helping them to move their arms or their
Right.
legs. And with that, managing let's see, I don't know if the whatever the mobility issue is, I'm
Mm-hmm.
sure if it's due to like a medical issue and stuff, but
Right.
managing those medical issues,
Mm-hmm.
managing the diet. Again, it all comes back to basics. What
Mm-hmm.
can you do?
Right.
If there's nothing else to do. And then, in that case, I would say, medications may come into play
Mm-hmm.
to help someone be more functional.
Okay. And how about like aquatic therapy? Would you recommend something like that, or any kind of like chair yoga or different
Oh
alternatives?
yeah. Oh yes, definitely.
Okay.
So that's perfectly fine. And aquatic therapy is very good. I've started incorporating that with all of my patients because you are weightless in water and you can move more in water. When you come out, you feel everything, um
Mm,
but yeah, but it helps you to do more. And I know you've probably seen like the athletes, like how they practice. They're doing their bicycling in the water and doing like all
mm.
these different things because they can do more.
Oh,
Hmm.
interesting. I didn't see that, but good to know. It makes sense
Oh yeah.
actually.
Hmm.
So, how long does it take? Let's say if we're taking the holistic approach to pain management, how long would it take to see results?
I give everything a good 12 weeks. Habits are, you kind of see the improvement in 12 weeks.
Hmm.
So, because sometimes it takes us a little bit to start. We think that things are instant, but we have to learn that things take time. So I would give it a good 12 weeks before I count it out.
Okay, sounds good. And
Mm-hmm.
finally, any last words for our viewers?
I would say, let's see, be great, right? And no, but I would say that let's see, pain is inevitable and suffering is optional. There are things out there that you can trust other than prescription medication. Like trust your given instincts and the things that you were created with, right? And that is your legs, walk. Do exercises, the things that you put in front of you every day, the things that you watch, the people that you are around. Just have positivity all around in your life. And if all else fails, someone like me is here and I can help to guide you in your pain management
Oh,
journey.
so nicely put. Thank you so much. And so, Dr. A, where can patients find you?
I practice in Clinton, Maryland, and I will give you my website address. It
Okay,
is www.privium Consultants, which is spelled Priv as in Victor, IUM, consultants.com.
thank you.
Mhm.
And again, just as we wrap up, I would like for you to explain to us again your acronym LANE. What does that stand for? I think it's a great way to conclude today's discussion.
Sure. So LANE stands for L, lifestyle, how we live, A, attitude, how we think, N, nutrition, how we eat, and E, exercise, how we move.
Excellent. Thank you so much. So, thank you everyone for joining us for today's episode, Beyond Pain, right? Beyond Pain Medications with Dr. Adaku Nwachuku. I'm sorry I didn't get to all of the questions on today's live. However, Dr. A will be sure to answer them on YouTube and Instagram. Thank you so much, everyone. Have a great day.
Thank you for having me.
You're welcome. You're welcome back anytime.
Thank you.
You're welcome.